can you guarantee these measures will be enough to, I guess, put a lid on this, and what would have happened if you hadn't taken these measures?
Yeah, I'm certainly hoping that this will make a significant difference to how much transmission is occurring. It's a very significant step up, and these are very broad and deep measures. So I can absolutely see cases decreasing. But in terms of a guarantee, government, public service can no more make a guarantee, because it's our collective responsibility to address this. We've talked about the fact that behaviours have to change profoundly. They have to change across the board. And so it's one thing to have communication engagement. It's another thing to have policy settings. It's another thing to have public health directions and new laws, state of disaster coming into force. But people have to go with those new directions with a genuine commitment and a genuine understanding that it's everyone's responsibility and that it will fail if a proportion of the population don't take it seriously, or if we think that it's for a couple of days but not for the next 6 weeks in full. It is a huge step up, and it's not an easy task, but it's a collective responsibility. And so, yes, I absolutely hope that we can change the direction. We know that stage 3 worked in the sense that the curve was genuinely flattening. There are estimates that 20,000 cases have been averted over the period since stage 3 restrictions have been in place, but it wasn't enough. And to look at the numbers every day through the lens of a healthcare worker, you could not tolerate 500 cases day in, day out, a dozen deaths day in, day out, a number of new outbreaks, a number of new nursing home residents infected. That is intolerable. So numbers absolutely have to change, but it's for everyone to play their role in doing that. I hope 6 weeks is enough. Again, it is entirely contingent on everyone in Victoria to make sure that it is enough. If we do the things that we know work, to test, to isolate, to have our close contacts quarantined, and to follow all of these directions that we're laying out today and tomorrow, 6 weeks should absolutely be enough. But it has to have everyone's cooperation and understanding and commitment. There's no question it's challenging for people. There's no question that it's going to be impactful. But they're absolutely necessary things. And the stage 3 restrictions showed that you can shift things, but we've come up against some really significant challenges. People who aren't aware, people who aren't following the rules, workplaces who are obliging their staff to turn up when they're unwell. Those things need to change. And so all of these measures, including the compliance and enforcement in workplace settings to make sure that workplaces doing the right thing by their employees for everyone's benefit, that all needs to come into place.
Transmissions that the Premier's mentioned, people in the streets of parks, is that happening in particular parts of Melbourne, or is it everywhere that you're seeing this street transmission?
Certainly community cases exist across Metro Melbourne and a few in country Victoria, not so many. They're also concentrated in the areas where transmission's been concentrated, but it is a concern that there are over 700 of those community transmission cases where we don't know where they picked it up. And in part that has been part of our deep dive, and the reflections that we've got from that is that if you only focus on the areas where you know that outbreaks have occurred and clusters are known, you will miss those other settings where transmission might occur. And we can't say for sure where they are, but we know that if we constrain those opportunities, then those community transmission cases, those mystery cases, will also diminish over time.
Is there a difference between what we've been talking about up until now as community transmission and mystery cases, or are they the same thing with a better name?
They're the same thing with a better name. They're genuinely mystery cases because we interview people. They can't nominate that they're a close contact of a known case. They aren't associated with known settings where outbreaks or clusters have occurred. They are literally saying, I don't know where I got it from. Here are the places that I've been to. And we can't definitively say it's here or here or here or here because they've been to half a dozen places. But we know that if we change those half a dozen potential places where a mystery case has been to only one for the purpose of getting food once a day or once a week, then we will have fewer of those cases because there are far fewer opportunities to pick it up through those, potential casual contacts that people haven't thought was significant in their lives. But these are the places where people are picking it up unknowingly.
Has Stage 3 restrictions was to only go to a shopping centre or to like essential reasons, supermarket and takeaway food being one of them. So casual contacts weren't allowed in stage 3. How confident are you that stage 4 is actually going to, that these people are going to listen to stage 4?
I think everyone can see how serious this is. We've got a state of disaster that's been declared. There's a curfew in place. Very significant changes in education. We'll have very significant changes in workplaces tomorrow. In part, there's some shock and awe here for people to genuinely understand that it's a super challenging phase that we're in. We knew that it would be harder. We knew that it wasn't like the first wave, but in part that's because the fatigue that people have experienced and the sense of complacency about being able to go out and do shopping for pleasure and not for absolute necessity is part of the challenge. But I think the message is loud and clear now that it's about essential services, essential goods.
Just on your comment on it being shock and awe, as soon as people realised that we were going to go into stage 4 restrictions, the first thing that they did was not adhere to social distancing and flood supermarkets and butchers. So are people actually shocked and awed in the way that you want them to be?
Look, there'll be people who respond on the basis of anticipating what's coming tomorrow. The message will be there's nothing to panic about. There are all of the essential goods and services will remain available to people. There's a 6-week period that we'll need to go through, but the things that people require for their essential day-to-day living will absolutely be available. There's no requirement for panic. It's a very human response. I can understand that people experience uncertainty when they don't know the full details of something, but I would assure them I'm not going out doing anything in a state of panic today. They just need to understand what the requirements are from tonight, 6 p.m. in terms of the state of disaster and the curfew kicking in at 8 p.m. And to understand that there'll be some constraints from tomorrow in terms of work, but that all of the essential things that they need day to day will be available.
What's the rolling say now about when the peak is?
Well, we would hope that from this point onwards we are really suppressing transmission. So maybe we're past the peak, but the effect on the numbers from any intervention that happens today and tomorrow again, will not be seen for another 7 days. But I think we're in a relatively flat period now. But again, it's intolerable to have a flat period of 500, 600, 700 cases a day.
Is there, generally speaking, is there a high proportion of younger people amongst those mystery cases? And is that a sign that they've been moving around more than...
Certainly, young people, 15 to 40 years of age, make up over 50% of our total cases, something like 53%. In part, our intensive care units have been protected by virtue of younger people making up such a significant proportion. But the huge numbers that we're seeing week in, week out will still show up in our health system. So we need to see those numbers through the eyes of our healthcare workers and the kind of awful fear that they have about what it means for people presenting to hospital. We need to get on top of the numbers regardless of the age groups that are affected. But yes, younger people are overrepresented in some ways, and our intensive care units have been protected by the relatively fewer numbers of people in their 60s and 70s who've contracted the virus.
What about pressure on the rest of the hospital system in terms of furloughed staff versus patients coming in? How critical is the situation?
It's not in a critical situation. There have been great surges in terms of mobilising other staff. There are obviously staff coming out of furlough, coming out of quarantine now who've needed to be there because they've been a close contact or because they've had a test and needed to wait for that result. But it's still, hundreds of healthcare staff who are either active cases or many more who are quarantining. So it is a challenge, but if there's any good that's come out of the restrictions that have been in place right throughout, it's that our flu numbers in Victoria, as for the rest of Australia, are through the floor. We have probably averted hundreds of deaths from influenza because of the physical distancing that's been in place and the much greater scope of immunisation that people have taken up. So that's a small ray of hope for our health system as well in terms of the pressures from flu. There's literally no flu going around.
Something that Brett said,